I looked up midwifery care. I watched lots of videos from the moment I saw the line on the stick. And in between both babies, I actually had a miscarriage. So I had gotten a midwife, miscarried, and then gotten a midwife again when I got pregnant. So lots of healing had to happen in between and during and all of that. So this birth, there was a lot of pressure for me that I had created around wanting it to end well. And luckily had a friend actually who birthed here with Midwives and chatted with her. And there was all of the testimonies or testimonials that I've heard about this experience have been good.
Midwives, I would say they do a fantastic job, and they provide client-centered care to women in pregnancy, at birth, in labor, and then postpartum. A woman is, provided with every information she needs to make the right decision for her care. And so midwives, they have privileges in the hospital to, provide care for women in labor in the hospital and also at home, hotel, anywhere they feel comfortable to have their baby, we're ready to go with them.
Midwives are trained in breastfeeding. We give to our clients education about that before baby is born. And then we have home visits after the baby is born. So if our clients have any concern with breastfeeding, we help a lot. Midwives also have a lot of knowledge about vaccination, because when we are doing the care of a pregnant woman, we have the knowledge to make informed choice discussions with our clients about vaccinations.
Midwifery care is great. So what I would kind of look at it as is going through birth with a friend, right? So you have someone that not only is knowledgeable in the healthcare field, but someone who generally has your best interest at heart.
You have somebody with you who knows what they're doing, and the relationship is there that you trust them. I think the outcomes are, a lot better.
I was specifically looking for someone who either looked like me or just someone that could understand. And thankfully I found at least someone who was Muslim who could help me through who could advocate on my behalf and feel comfortable and genuine.
Accessible midwifery is, first of all, general awareness that it's covered. That's a big piece.
When patients have choices, it enhances their care. Collaborative practice is to the benefit of the patient. It doesn't hurt, but it can benefit the patient in many ways.
They should be able to have a voice, and it's about time for us to create that platform and the awareness for them to know that they can and they should be able to have a midwife of their choice.
Midwife can offer this holistic approach where you can give a woman the opportunity to have the baby in a safe space, but the most normal, like we did it before. We have babies at home for years.
I would highly recommend a midwife. This person is with you before baby and after baby. Whether you're giving birth at home or in a hospital, that person is your go-to person.
My work or my life has been able to impact people on the positive side. My name is Joy, and that's like the summary of what I give back.
The thing that I didn't know when I started this whole journey was how much I would really, really love it. I really love being able to bring ceremony back into birth and connecting people in the community, all of those pieces.
I would say what you're choosing is a partner on this journey. Beyond the partner that exists who you created this child with is another person in the room who reminds you and your partner of all of the plans, the dreams, the hopes that you had before this child was born. I have never felt more powerful in my entire life, and I probably never will again. Yeah. For many women, much of our pregnancy and childbirth and delivery journey is marked by pain and fear. I think what we need to come back to is the idea that what is happening to, around, and with you is a perfectly natural and normal process. And every tool that you need to make that happen exists.